firstly, thank you, Dr. Hawrelak, for joining me. As a practitioner that has done your healthy gut practitioner and microbiome analyst training, I have learnt so much from you, and your teachings have really impacted the results that I get with my clients in a profound way. So thank you for being such a generous teacher and mentor to me and many, many others in our profession. For those of
You're
you
welcome.
who
I think it's like important to share experience when we learn. I think I
yeah.
have remarkable elders that I've learned a lot from, because they're willing to share what they learned in years of practice, and it allows you to shortcut through a lot of trial and error. And I think for my early years was a lot of trial and error too, of working out what worked, what didn't work. Studies said something worked, you try it on people, no, bloody doesn't work.
Yeah.
And how long does it take to work? And so I think if we
Totally.
can have some, moving towards eldership now in our profession, to be able to share that kind of information to make the journey of other clinicians better, and make the patient outcomes better. It's it's an honor to do so, really.
Yeah, that's right. We're very lucky. Thank you. So for those of you who aren't familiar with Dr. Hawrelak, he's a naturopath, a herbalist and nutritionist with nearly 25 years of clinical experience in gastrointestinal health and exploring the gastrointestinal microbiota. He's widely considered to be one of the world's leading experts in the treatment of gastrointestinal conditions with natural medicines. He's been teaching and mentoring in this field for more than 2 decades, and has written extensively for Australian and international textbooks and journals, and regularly presents to other health professionals at conferences all over the world. So I'm super excited to pick your brains today, Dr. Hawrelak, on all things microbiome. Thank you so
My
much.
favorite topic area.
Yes, I think you could talk underwater about this, couldn't you, all day, which you
For
kind of
days at a
do.
time, I think. Yeah, well, it's true, actually. Between
Yeah.
teaching and between patients, it would
Yeah.
be 5 days a week where I would be
Yeah.
talking about this all day.
Yeah. Well, why don't you start by telling us why the microbiome is so important? Why should we care for it and look after it?
Yeah, and I think for me, it's been an interesting journey, this one too, because as you mentioned before, I would have started my honors thesis on my literature review from honors thesis around the gut microbiota, and its important irritable bowel syndrome back in probably November, December 1999. Yeah, so a long time. And even at that time, there was enough literature that we knew the microbiome was important, and there's only a handful of researchers worldwide, I would say, who were lately like pounding the drum on this one. It's like these microbes are important, and we knew then that they're important for immune system development and for immunity to function properly, for what our sort of gut motility to be normal, enhancing our nutritional status, but by B vitamins and vitamin K. We knew some of those things back then, and also some conception around that they protect us against getting infections, food-based infections too. Those things we knew for a fair while. But to see the sort of boom in research that occurred probably from the early 2000s onwards, where we're actually linking the gut microbiota not just for like gut conditions or just immunity, which is already good enough reason to care about these microbes. So actually, these microbes are tied into everything. It's probably not a system in the body that isn't impacted by the microbes in our gut. From we already talked about immunity, but our metabolism, mitochondrial function, cognitive function, can all be impacted. And we know we've also moved from that stage where we are seeing disease correlation, where we're like, okay, people with this disease have an altered microbiome, but maybe the disease causes the microbiome changes. Yeah, that was some thinking at the time. It wasn't mine, but some people were putting it out there at the time. Versus this change in the microbiome causes the disease. And this is where we've seen a huge leap in the last sort of 15 years of going, actually, we can pass on obesity by doing poo transplants. We can pass on diabetes by doing poo transplants. We can pass on anxiety. We can pass on depression. We can pass on high blood pressure, Alzheimer's disease by doing poo transplants. It's really all these conditions that that are all ubiquitous in Western nations, that actually have a microbiome cause, we can kind of pass on to other beings by doing poo transplants, which is fecal microbial transplants, which is pretty crazy. And even someone who's a microbiome passionate person 25 years ago, would not have thought that it would go the way that it had. And I think also as a naturopath, it's like you go back in our history, it's like there's naturopaths again, beating the drum about the importance of the gut microbiome,
Yeah.
different terminology, obviously, back in the early 1900s, you know, the
Yeah.
importance of looking at the gut microbiome, making sure they had enough fiber, enough sort of plant
Yeah.
foods in their diet,
It's all the
you know, having
same,
time in
isn't
nature.
it?
And some of the
Yeah.
things that scientists are finding now was stuff that naturopaths were actually been saying for over
Mm,
100 years, you
mm.
know.
Yeah.
Yeah.
Yeah. Yeah, so those little trillions of critters in there are pretty impactful on our health, that's for sure. Yeah. So you've been analyzing microbiomes for so long. I mean, how many do you think you've analyzed over the years?
I know it's a
Have
good
you
question. I mean,
kept a
that's
running tally?
trying to look at. No, I probably should have. I mean, even just looking at how many clinicians or patients I've probably seen is probably like over
Yeah.
conservative estimate over 15,000 sort of patients
Oh,
in that
wow.
time, and a lot of that would have been, you know, microbiome work and gut health
Mm,
work.
yeah.
And obviously, back in the early days, the tests we had available
Yeah.
were comparatively poor.
Yeah.
That was the best we had at the time,
Yeah.
because like we could look
Yeah.
at 4 types of gut bacteria on the stool test. Just,
Wow.
you
We've
know, and
come
we're
so
making it.
far.
I know we have come so far.
Yeah.
And that said, like you're still able to, you know, as a clinician, you can still prescribe dietary protocols, lifestyle
Yeah.
protocols, pre and probiotics, and you see the change in disease conditions and the person's
Mm,
condition from treating them. Even if we
mm,
had the tools were so crude, we couldn't really analyze the microbiome very well. Yeah.
yeah.
The tools I was using are very similar to what we're using now, although obviously a lot more of them now, and we understand the mechanism in a lot more detail.
Yeah.
But yeah, seeing the stool test evolve that we have access to remember when the stool test went from having 4 bacteria to 12. You know, the
Mm.
first GI fix was like 12 bacteria. It's like $800 for the
Whoa.
test, but we could
Oh,
tell we see
wow.
12 bacteria as part of that. And that was like a
Oh my
major, like, you know,
gosh.
like, oh my God, that's so much better.
Yeah.
And then we evolved
Wow.
onto the first sort of better DNA-based lab that was offering easy access tests with uBiome. And
Hmm.
they for $100, someone's on sale for
Mm.
$50, you could actually
Whoa.
analyze the entirety and see that potentially 400 species of bacteria that's in people's guts. Now
Mm.
people, it's a
Mm.
lot far less than that, but you get to see the entirety. That was also a major game changer, because all of a
Yeah.
sudden we could really see things as clinicians. Yeah, as
Yeah.
research evolved, we started being able to see disease patterns a lot better, because before we were relying on again crude technology to try to see
Yeah.
connections. And as technology advanced, we could start making these disease associations in far greater detail and a
Mm.
far greater number.
Mm.
And then eventually that trickled down to clinicians or the general public, where we can actually look at the microbiome now in a, you know, not overly expensive way,
Yeah.
um, and directly see the impact of our diet and lifestyle and medication choices on our
Mm.
microbiome, and how we can change our diet and lifestyle or take some prebiotics, and
Mm.
you can see the dramatic change in your microbiome as a consequence.
Mm. Oh, which is so exciting and so motivating, I think, for people as well, to be able to literally see how they change their diet, affecting their microbiome and therefore impacting their health, which is just so amazing. So, yeah, you've obviously analyzed thousands and thousands
Yeah.
of microbiomes. And so, what would you say are the 3 kind of major things that you see people doing that impacts their microbiome in a negative way?
Yeah, number 1 on that list is probably not going to be too surprising, but antibiotic use,
Yep.
and I would argue also include proton pump inhibitor use, so the medication
Mm-hmm.
is used for reflux. Yeah,
Yeah.
overuse. Yeah, I mean, antibiotics save lives, they save limbs, but they're way overused. Yeah,
Yeah.
and then even proton pump inhibitors, I think, have got a use, but they're way
Mm.
overprescribed
Mm.
for way longer than they should be. And what
Yes.
people don't know is that PPIs have antibiotic-like effects. And I
Yep.
think it's 20% of the species in your gut are negatively impacted by
Mm.
PPIs. Your diversity goes down even after 7 days of use of these
Yeah.
things, and people are put on them for often life. You know,
Yeah.
usually not necessarily intentionally. They're not necessarily
Mm.
told that, but that's kind of what the
Mm.
outcome is for many people.
Mm.
And these things cause massive disruption. Antibiotics, you know, can cause extinction level events, and I think that's the
Mm.
thing that people aren't told about. So we have a viral infection in your lungs, and you're offered antibiotics. It's like, no, you know, I'm not going to take something that's going to potentially wipe out, make a number of species in my gut go extinct,
Yeah.
cause massive disruption to the ecosystem. That's going to take, you know, 4 to 6 weeks before it kind of settles into a new pattern that's completely different than it was
Mm.
before.
Mm.
For no benefit, which is essentially what
Yeah.
we're asking in
Yeah.
that situation.
Yeah.
So I think it's being really aware. Do you really need this substance, this antibiotic, or this
Mm.
proton pump inhibitor is it really necessary? Can we do something else to treat this condition instead? Like, I don't know, change your diet, or, eat smaller meals. I mean, the reflux is one of those things that as a naturopath, there's so many tools
so
we
many
can
things.
use.
Yes.
And lifestyle, dietary factors, herb medicine, supplements that can modify that condition, that you don't have to go down a route of taking a proton pump inhibitor. That negatively modifies your microbiome, encourages, increases the risk of SIBO development sevenfold. Research found even just 1 week of PPI use caused nearly 8% of people develop SIBO just after 1 week of PPI use. It's very substantive changes in the small and large intestinal environment. And you start getting molds and yeast growing in the stomach. It's like a really bizarre consequence of that medication class, never mind the increased risk of Alzheimer's disease and osteoporosis that come with that too, which would be related to the microbiome harm too. Now that we dig into that more detail, it's like, oh, actually, osteoporosis is caused by dysbiotic changes in your gut bacteria. Who would have thought? We know now many of us are on that bandwagon, but that's relatively new. That information of how the microbiome interacts with bones, the microbiota bone axis, the microbiota lung axis, microbiota brain axis. We're making all these sort of microbiome mitochondria axis. There's all these correlations we're making now about how the composition of your gut ecosystem impacts your risk for so many different diseases that we see commonplace in Western nations. So those medication classes, I think, are particularly problematic. Ultra processed foods, I think, is the other thing that when you look at the supermarket trolleys around you in this typical city, as a naturopath, I've always been a bit shocked by what goes in there, but that's what most people are eating, and you're like, no wonder we have so much obesity, type 2 diabetes, because we're eating all this ultra processed food that's devoid of fiber, devoid of plant polyphenols, but also contains chemicals that are harmful. I think that's the other aspect too, is we get the dietary emulsifiers that strip away our protective gut lining, and cause leaky gut, and they're commonplace in processed foods. Never mind agricultural chemicals. Again, as we delve, more research is being done, it turns out that almost all of them kill good bacteria and encourage the growth of bad bacteria. It's like, great, we're exposed to that too. So ultra processed food, I think, is one of the other aspects. And I think probably also in the dietary aspect is having plant food restricted diets. So there's dietary protocols that are cutting out plant foods. They essentially will result in microbiome harm too, in varying degrees depending on how severe the restriction is. But you cut out just legumes, there's consequences to that. You cut out legumes and whole grains, there's consequences to that, and they're not positive from a microbiome perspective. Or I'd argue gut health perspective either.
Because those fibers that we get in those plant foods are what our beneficial species in our microbiome love to eat.
Yes,
and helps them to proliferate.
And it helps them produce the anti-inflammatory gut healing compounds like butyrate. And that comes from us eating legumes and whole grains and root vegetables. We don't get much butyrate production from eating leafy greens. I love leafy greens. I eat them daily in large amounts, but they don't feed my butyrate producing species. I love eating fruit daily too, and they're not necessarily good at feed my butyrate producers either. But whole grains, legumes are particularly good at that, and root vegetables too.
Yummy. That probably leads into the top 3 things that people can be doing to support a healthy microbiome. So would you say one of those is, eating lots more plant foods, and particularly
lots more plant foods and diversity of diversity, color diversity. You want to have a rainbow on your plate, and just having nuts, having seeds, having legumes, having whole grains, fruits, and vegetables. Because that way you're getting a wide diversity of different fiber types, because, not all fiber is one thing. It's like different plants will have different ratios of all different shapes and sizes of fibers that feed different microbes. And that's where the importance of diversity comes into it. And the color compounds are from polyphenols, and they feed different bacteria too. So by doing that, we're just nurturing the widest number of beneficial microbes in our gut and encouraging an environment that's conducive to good bacteria and less conducive to problematic or pathogenic bacteria. We tend to have growth of the more problematic species when our gut becomes more alkaline due to lack of fiber, lack of polyphenol consumption.
And
I'd say also
else?
time in nature. And I think that's something that we probably don't prescribe as much as we should. It's
Mm.
kind of,
Yeah.
even though something, the old naturopathic thing was like have
Yeah.
time in nature,
Yep.
and nature cure all came from, in
Mm.
part with the idea of being in nature is a healing process. And I think
Mm.
for microbiome, it totally is too. I mean, there's a number of
Mm.
reasons why I think we get healing going from a bushwalk or going for a run and swim on the beach, for example. But microbes is part of that. Like when we're able to go into more intact nature, but at worst, even a rural a park in an urban center, you'll pick up more microbes from that, and you can enhance your diversity from that process too. Yeah. So I think never neglect the importance of just spending time in nature as well. It heals us in so many different ways, but also from a microbiome perspective, it definitely does too. I'm trying to think of the other things that are kind of flow from that, but I think, farmers markets, I'm just going to go with that because I think that's something that we get numerous benefits in society in numerous ways if we support our local farmers markets. But from a microbiome perspective, we get huge leaps and bounds improvements in microbiome diversity if we're able to source some, if not most, of our food from the farmers market too. Because what some people don't know is that like your an eggplant, a tomato, apple all have their own microbiomes. Yeah, they're covered with different microbes. If we buy those same foods from a supermarket, they have the same number of bacteria on them, but they're completely lacking in diversity. In fact, there's a supermarket microbiome, so which means that your apples, your eggplants,
So
and broccoli all
scary.
have the same microbes on them, and the
Yeah.
same number.
Yeah. Oh.
Versus they're all supposed to have different microbes on them. Yeah. So
Yes.
as a way of interacting, your ecosystem interacting with more microbes is like you grow your food, you buy it from a farmer's market, you get so much more diversity exposure from that. And that I think is key. That there's a number of markers by which we judge a healthy ecosystem, and diversity is certainly one of those key ones. And if we're able to grow some of our own food, to buy some of most, or at least some of our food from the farmer's market, we will improve the diversity of our ecosystems. And I suppose flowing out from that too, buying as much organic as we can. And I know cost-wise, it can be hard to get 100% organic. And I've certainly had times where you're prioritizing some things organic and some things you just can't buy from your locale. But even a bit of that's going to be helpful. And if again, from a microbiome perspective, organic food has got far more diverse microbes on them. And we spray them with chemicals, we tend to select for more bad bacteria on those foods and less good bacteria and less diversity altogether. And those chemicals that we spray on that food are likely to cause our gut harm too, and our own microbiome harm too. So another reason to choose organic.
Yeah. Plus, it just tastes better and has more flavor as well.
Yeah, and more phytochemicals too. Generally as well. So it's more nutritional value in general, and usually more phytochemicals because the plants are a bit more stressed. And when plants are a bit more stressed, they make more of the phytochemicals, which are the antioxidants, the anti-cancer, anti-inflammatory compounds that we're hoping to get from our plant foods.
Yeah, makes sense. So let's shift a little bit now and talk briefly about menopause. I see lots of clients who are in perimenopause or going through that menopausal transition. And we know that during that time, due to the loss of estrogen, the microbiome starts to become less diverse. And as you've already said, a more diverse microbiome is a healthy microbiome. So why is it important not to let this happen at this stage of life in particular, would you say?
Yeah, and I think it's also relevant to males of a similar
To
age.
men,
We don't have a
it
term for it too,
is.
but we link in like the microbiota tends to change as we age, particularly in Western nations. And that actually speeds up the aging process depending on how quickly or slowly that microbiome change occurs.
Right.
So essentially what we're trying to do is prevent and slow that change of microbiome to an aged sort of microbiome. And we know that people that live really well, healthy lives, their microbiomes are akin to people much younger than them. So it's going to be, we want to support diversity. We want to make sure we support the level of beneficial bacteria by encouraging eating the right foods, avoiding medications that cause those microbes harm, to encourage the population to stay high during those times of transition. Yeah. And we know it is important for, postmenopause women are far greater risk of osteoporosis, becomes much more of a thing at that point. And we know that the microbiome at this point is one of the key drivers of that, depending on the composition and that, again, it's that aging microbiome. It would be seen as
Mm,
a driver of osteoporosis, a driver of more metabolic dysfunction and hard time,
mm,
easier time gaining weight, harder time losing weight would fit into
yep,
that sort of the changes we see during that time. Yeah, so
yeah.
it really does need to be on our radar as clinicians, to as a part of that strategy of working with this, your question about working with women in that scenario is making sure that the
Mm,
microbiome is considered when looking at osteoporosis, looking at
mm,
excess weight gain or cardiovascular risk factors, metabolic risk factors that would tend to increase after that time point, because
yeah,
microbiome influences all those things quite
yeah.
considerably, which means we also have amazing power to alter
Mm,
that one area and have
mm,
all these ripple effects that go out. Because if we can change the
mm,
microbiome, we can reduce the risk from that one sort of interventional focus, reduce
yeah.
risk of osteoporosis and
Mm,
cognitive decline and Alzheimer's disease and heart disease and also I do cancers too. Yeah,
yeah.
it's a pretty amazing opportunity we have of influencing a
Yes.
wide range of disease processes in that one focus area.
Yeah, and I think yes, coming into that life stage where those risk factors go, or they all go up for
Yeah,
women during that life stage. Yeah, it's the perfect time to really get in there and try and improve that microbiome health to mitigate against that future risk of chronic disease. I mean, why wouldn't you?
yeah.
Yeah.
Probably just
um,
lack of knowledge
Lack
of
of
the
knowledge, I
importance.
think,
That's probably the
yeah,
reason why.
because I think all the talk is around the symptoms and the hot flushes and the insomnia and
Yeah,
that side of things, but without, yeah, I think the discussion, including gut health and the microbiome, is almost more important, as important, because we do know that women are, at higher risk during that time.
yeah.
And yeah, great. So is there any specific gut health advice that you would give to women in that life stage in particular?
I mean, some of that stuff is going to be considered what we've already talked about. In
Yeah.
reality, it's going to, well,
Yep.
those truly are the best ways of making your microbiome the healthiest possible. We've touched on already,
Yep.
irrespective of age group or disease state. I think things can be
Yeah.
tailored from that point, because there'll be certain
Yep.
conditions where actually I can't just have them go and start gorging on legumes three meals a day, 5 to 7
Yep.
days a week is like not appropriate. We have to
Mm,
fine tune things and
mm,
individualize it. And again, and this is where I love that the capacity we now have of microbiome assessment is we can go, okay, well, let's
mm.
look at this woman's microbiome. How can we best modify that microbiome at
Yep.
that point to get the best outcomes for them? Yeah, because everyone, their ecosystems are unique, and
Yes.
can respond a bit differently too, even though most people will respond
Mm,
very similarly to the main interventions we've talked about here. But you might need a bit of a
mm.
helping hand with
Yeah.
a prebiotic supplement to really encourage the growth of certain beneficial bacteria. Or you might have, you're osteopenic and you have this very high levels of let's say problematic proteobacteria. We know that they're byproducts called endotoxin. They're the core driver of osteoporosis. We need to address that
Mm.
aggressively now, rather than
Yeah.
doing it more slowly through dietary means over the next
Yeah.
6 months. We're like, okay, well, let's take a herbal product to smash those bacteria down, or the right prebiotic, so we can get
Mm.
a change occurring more quickly. Yeah, so I
Yeah.
think that the broader stuff I discussed is totally relevant. But
Yeah.
if you get a microbiota assessment done, that means you can fine tune and tailor the treatment protocols within that to your specific ecosystem, so you get the best results possible for you.
It's really personalized, which I
Yeah.
love. Yeah. Well, I think that's it for me from Quest for Questions. Thank you so much again, Jason, for chatting with me today, and taking time out of your day to really just shine a light on our microbiome and why we should be taking as best care of it as we can, especially as we're aging. Not you, just
Yes.
me.
No. I mean, I think
Yeah.
you get to that age, like I'm 51. It's just
Yeah.
like I want to age well. I want to
Yeah.
have a lovely health
100%.
span, and
Yeah.
that means a bunch of different things, like exercising and a bunch of things that were probably less so in your radar than 20 years ago as a
Yeah.
necessity. But it also means the imperative of keeping your microbiome
Mm,
in a healthy
mm,
state too, and that should be
mm,
part of our sort of aging regime
mm.
is care of the microbiome.
Yeah. Couldn't
Yeah.
agree more. Yeah. Thank you, Jason.
All right, you're welcome, Bronwyn.